Of admission in a number of hospitals. This is according to the Kenya Medical Practitioners, Pharmacists and Dentists Union. So dire is the situation that patients arriving in hospitals have to wait for the occupants to die to find space. This is as a result of the third wave of COVID-19 that continues to spread in the country.
The third wave of COVID-19 continues to spread like bushfire across the country, causing pain, anguish and anxiety. In recent weeks, there has been an increase in the number of infections as well as deaths reported in the country. Now, the Kenya Medical Practitioners, Pharmacists and Dentists Union admits that there is no space for admitting more patients in some hospitals. This also applies in the intensive care unit. So bad is the situation that those bringing in patients have to wait for the occupants of the beds to either recover or die for them to find space. Currently, the number of doctors admitted in hospitals is 10.
We find ourselves as a country 1 year into the pandemic at a tipping point. And I'm saying a tipping point because we've had 1 year to make sure that we prepare our healthcare system adequately. So 1 year down the line, in a third wave, there's an increase in the number of cases, increase in the number of mortalities. And as the healthcare workers and as the doctors of this country, we are concerned about this and the general state of laxity in adherence to the COVID-19 preventive measures.
The rising numbers of COVID-19 cases have also seen a high demand of oxygen by patients in our facilities. Majority of our county referral hospitals have built, some are building, their own oxygen generating plants. But even as we plan for oxygen capacity enhancement in our facilities, people need to ensure that they avoid any activities that might expose them to the virus. Let us not have to experiment with our oxygen capacity when we can avoid it.
The country also lacks enough doctors and nurses to attend to patients.
The shortages in the country and in the counties are real. The infection is straining the workforce. The fact that the terms and conditions are not yet fully addressed. The Ministry of Health last year hired 235 doctors to work in isolation and treatment centers across the country. These contracts, they were hired on contracts. The contracts expired in the month of February. And out of that number of 235, we only have 156 currently active. Most of them, the 60 or so, found better options and left the service. So we are at a point where our COVID situation is that we need as many doctors in the counties as possible.
Today, 1,127 people have tested positive for COVID-19 out of a sample of 5,393 tested in the last 24 hours. The country has a positivity rate of 22.1%, as the number of those who have died from COVID-19 is at 25. Nairobi County is leading in the number of infections, which is at 575, followed by Nakuru with 99 infections, then Kiambu, Machakos, Kisumu and Uasin Gishu. Over 1,000 COVID-19 patients are presently admitted in hospitals across the country.
Output is on the website and on
KMPDU now wants the Ministry of Health to employ more doctors. Sharon Baranga, TV 47.